Hi, I'm Dr. Jonathan Spages. I want to do a quick video, and I do a lot of these videos for people who are diabetic. If you don't know anything about my past and my history, is that I have been able to reverse diabetes on patient after patient using a very, very unique way of doing it. There is a webinar if you're interested. Just click the link below to check out the webinar about how I take somebody full-blown diabetic and after a short period of time reverse their diabetes. So real quick, let's talk about diet. Diet and diabetes always comes up as, oh, I know what to eat or I know what to do. It's actually an interesting topic. So there's basic guidelines to diet. Okay, so obviously you shouldn't eat junk food, things with tons of carbs. Alcohol is not good for you. Obviously, things with a lot of sugar in them. Those are pretty common sense things, right? And I don't think you need to be hearing a doctor tell you to do those things. That's something you can Google or just find on your own. The difference, though, between the diets that I do with patients and work with patients to help them reverse their diabetes versus just general information is the following. When you know why someone's a diabetic, like really know by doing very comprehensive labs what's causing their diabetes, what's making their blood sugar levels go up, it's actually a lot easier to put a diet together for them. Because if you just guess your way through it, maybe a food can make your blood sugars high, maybe it can make it low. Maybe some foods will cause you to gain weight versus others that won't. But when you have the labs, right, when you have a very comprehensive workup of blood, saliva, stool, and all the testing necessary to figure out exactly what's causing the blood sugar levels to go up, it's a lot easier to really figure out exactly what that person should be eating and what they should be doing to actually make improvements. And when I talk about improvements, I'm not talking about, maybe a slight improvement. I'm talking about a drastic improvement where they're able to actually reverse the disease and also go back to their doctor. And with the improvements, their doctor could make changes in lessening medication. So I put this video together so you have an understanding that I can go over here and tell you all the foods to eat or not to eat, but because specifically I may not know you or know anything about your labs, I don't have any exact details. Okay, so that's why I always recommend getting a very full workup of labs to figure out what's making your diabetes tick in the first place and what to do about it. All right, so check out the webinar. It's a free webinar and it can give you a lot of insights on a whole different approach to actually reversing diabetes. All right, thank you very much for watching. Have a great day.